Good morning, everyone. It's a pleasure to join you here at the Mazankowski Alberta Heart Institute for today's announcement. Albertans living with rare diseases face numerous challenges. Okay, I'm getting some feedback. Can you hear me all right? Yeah, okay. Among those challenges is the lack of treatment options. We know that prescription drugs can improve an individual's life and health, and they can have potentially life-changing effects for that individual. However, with only a small percentage of rare conditions having treatments available, Albertans living with a rare disease often have limited or unaffordable options. In fact, if a drug therapy is available for their particular rare disease, the cost can range from $250,000 to $1 million per person. Alberta recognizes this, and we know how important it is to support Albertans' health by providing coverage for effective drug therapies, which is why we are currently able to provide comprehensive coverage that offers access to more than 100 rare disease drugs through a number of provincial programs. In the last fiscal year, Alberta has spent more than $130 million on drugs for rare diseases. That's just in 1 year. That said, with the additional funding provided through the National Strategy for Drugs for Rare Diseases, we will be better equipped to provide Albertans with access to even more new and emerging drugs. I'm pleased to share that the first new drugs to be provided in Alberta through this agreement that we will be announcing very shortly, and I want to welcome Minister Holland, Federal Minister of Health, here. So one of the first new drugs that we will be providing through this agreement today will be Potilogeo for the treatment of Sézarès syndrome, which is the type of cancer that affects your skin and blood. Oxlumo for primary hyperocosuluria, and that's a mouthful to say. Hypocosuluria type 1, a disease resulting from a buildup of oxalate, which can lead to kidney stones and kidney damage. And Epkinly for some types of lymphoma, which could affect several organs, including the spleen, liver, or bone marrow. Along with the federal government and our provincial and territorial counterparts, we have worked together to compile a list of new and emerging rare disease drugs. The list, known as the Common Set, is the result of more than a year of development to determine a small set of new drugs that will be cost shared and covered in a consistent way right across the country. The 3 new drugs I mentioned have recently been approved for use in Alberta, and as a result, were seen as a good fit under this new agreement. This list will help inform future rare disease drug approvals to help increase benefits for all rare disease patients. And we expect to add even more new drugs from the agreed upon list as they become available. In addition to this expansion, this funding will be used to enhance Albertans' access to proven existing drugs, as well as early screening and diagnostics. So this enhanced coverage will be provided through Alberta's existing drug programs, building upon the coverage and access to drug treatments already available in our province. With this funding, we will enhance our efforts to offset the financial burden associated with these high-cost drugs and make them more accessible to patients who need them. Albertans living with rare diseases need effective treatment options. We are working to ensure that they have access to even more of those critical drug therapies. And most importantly, the opportunity to improve their well-being and live life to its fullest. In closing, I'd like to thank Minister Holland and Health Canada for their collaboration throughout this process and to ultimately reaching an agreement. He's always been a wonderful partner to work with, and I just can't say enough good things about the relationship we've been able to build during our times as ministers of health in our portfolios. It is important that we continue to find ways to work together in a partnership approach to achieve our mutual goal, supporting the health of Albertans and all Canadians. So thank you so much, and I'll now turn it over to Minister Holland.
Bonjour, c'est un grand plaisir d'être ici avec mon ami ministre LaGrange, et pour une annonce vraiment importante pour notre système de santé. C'est un temps essentiel pour notre système de santé. C'est vraiment un temps où une transformation est absolument essentielle. And today is an important step on that path. And I want to start by thanking Adriana, who absolutely has been an amazing partner. This is the third agreement that we've done together. We were both appointed around the same time in these roles, and we've really been able to have wonderful conversations about how we work together to help transform our health system. First, we had an agreement on working together, dealing with primary care, where we've seen huge progress in Alberta in terms of the number of physicians and nurses. We've been able to work together on that, on aging with dignity, and now on drugs for rare diseases. And I'm going to speak about that for a minute. Imagine a circumstance where you or somebody you love gets a diagnosis. You find out that you have a rare disease. It's something you didn't expect. It's like a bolt of lightning striking into your life. It turns your entire life upside down. And I know for Adriana and I, as we go across, in your case, Alberta, for me, the country, and you talk to patients in that circumstance, it's an incredibly heavy load to metabolize. And imagine on top of that, that you have to have a conversation about the cost of your medication, having to face a cost that is going to cripple your family. You have to sell your home or put your family in a precarious situation, maybe not be able to send one of your children to school. The stress of having to deal with that financially on top of a difficult diagnosis simply is unfair. And I think this is such an important step in making sure that the folks who are diagnosed with a rare disease get access to the medication that they need, and that we have the right screening and treatment tools overall. You know, 1 in 12 people live with a rare disease, and as I say, most treatments are too costly. Today, we are proud to announce $162 million in a bilateral agreement to improve access to selected new drugs for rare diseases that Adriana was just talking about, to improve enhanced access to existing drugs, early diagnosis, and screening. It's a first step in funding for access for 3 different drugs, as we mentioned, under the National Strategy for Rare Diseases, and a coordinated national approach. And maybe I'll just speak for a second about, some of the conversations you and I were just having, Adriana, about our health system. Folks, we can't afford the status quo. We have about 70% of chronic disease and illness is avoidable. Most of what's in our emergency rooms, most of what's filling our hospitals and filling our different medical facilities across the country doesn't need to be there. We have an opportunity to transform our health system. It doesn't just make sense as a matter of social justice and health outcomes. And of course, that's what we care about first, making sure that people that we love and ourselves, we don't get sick. But secondly, the opportunity from a cost avoidance perspective of having a system that's only focused on what it has to be a prevention-based system rather than an illness-based system. And that's why the interventions that we're making in areas like drugs for rare diseases, in pharmacare, in dental care, are so essential. And Adriana and I have said, I know Alberta has an interest in managing the dental care program. I have no problem with that whatsoever. But we agree on the idea that people need to be connected to care, that when people are connected to the care that they need, they avoid being ill. Imagine in the dental care program, in just 6 months, we were able to connect 1 million people to care. To put that in a really visceral way, when I was in Gander talking to Dr. Redmond, in just the first 3 months that he was seeing Canadian dental care patients, they identified 3 oral cancers. Those are oral cancers that would not have otherwise been identified. And you imagine what would have happened to those folks if they hadn't been identified. And so having a focus on prevention, making sure that patients have the drugs that they need, making sure that we're upstream, investing in research, being rooted in data, science, and evidence is so essential. And I'll close on this, which is the extraordinary opportunity that we have in health data, interoperability, and connection. And I know that Adriana and I had a great conversation today on this. We continued to talk about how essential it is for us to work together. I'm so committed to that because Canada has an incredible advantage, and we shouldn't lose sight of that. Yes, absolutely, we have to measure our success by gross domestic product, but so too we should measure the success of this country by how long we live in good health. Right now, Canada is number 2 in the world, or it's number 2 in the G7, I should say, in terms of the number of years that we live not being sick or in disease. We're 1 year ahead of Italy. We're 1 year ahead of France. We're 2 years ahead of the United Kingdom. We are 6 years ahead of the United States. Canada has the opportunity, Alberta has the opportunity to be the best places in the world in which to live and to stay healthy. That isn't just exciting as a matter of personal reflection on what it means to us. I mean, I think of my mother. She's 80. She's going to tailgating at a Buffalo Bills game. She's out there active in the world. We want that for all of us. It's not just a matter of social justice. It's a matter of productivity. It's a matter of cost avoidance. It's something, regardless of our political stripe, that we can do. And I'm so excited to work on that transformation with Adriana and to be here today for this incredibly important announcement. Thanks, everybody. Now we're going to sign and we'll come back for questions. A little closer, Matt.
We can't hear you.
Yeah.
Okay.
I'm Minister Holland's press secretary. Je suis l'attaché de presse du ministre Holland. We will begin with questions in the room before taking questions with Zoom. Please state your name, media outlet, and to whom your question is directed. You will have the opportunity to ask one question and one follow-up. Nous commencerons par les questions dans la salle avant de prendre les questions de Zoom. Veuillez indiquer votre nom, votre média et à qui vous posez votre question. Vous aurez la possibilité de poser une question avec un suivi. Let's proceed to the first question. Nous allons passer à la première question.
Hi, thank you so much for taking my question. It's Shaylan Skalski with CTV News in Edmonton. It's for both of the ministers, slightly off topic. I'm wondering where we're at with talks on pharmacare. You talked about working together, but I'm wondering what's holding up the progress on Alberta getting its fair share of this federal funding. Is it likely to happen? And if so, when?
Sure. Our departments are working very closely on that. There's a lot of behind the scenes work that has to happen. As Minister Holland will share, while they've gotten close with some provinces, there's a lot of other provinces that are still taking, we've been very clear that we want to enhance the comprehensive programs we already have in place. So those are discussions that have to happen. But as you can see, we've been successful on other discussions, as Minister Holland indicated, the shared priorities, the aging with dignity, and now the rare disease agreement, bilateral agreement. And I'm confident that if we continue in the vein of working together for the common good, that we'll get there. I don't know if you wanted to add anything.
Yeah, absolutely. Look, I think this is the third agreement that we've signed on drugs for rare diseases. That's a big deal. It's the third agreement that we've signed together, and it's the third agreement on rare diseases, period. And that's because of the really strong working relationship that Adriana and I have and our officials have working together. We're having very constructive conversations. The reality is it's complicated. This only passed the House and the Senate on October 5th. So our officials have been working hard, but we are, I think, completely aligned in wanting to make sure diabetes patients get the medications that they need. I think we're completely aligned in wanting to make sure that folks get the contraceptives that they need. So the conversations have been very positive, and I think the fact that we've been able to get 3 other agreements speaks very positively to our ability to get it done on pharmacare as well.
Yeah, just following up on some of those questions, if you can speak specifically to the challenges that you've had thus far and any kind of timeline, can Albertans expect this help as early as next year? And then also, I guess, just the pitch. Minister LaGrange, I guess, why do you think that Alberta having its fair share of this plan would be better? And Minister Holland, I assume you have a different stance and that Albertans would be better off with a federal plan. So why is that?
I believe that we're in agreement that we would be better enhancing the programs that already exist. Minister Holland doesn't want to duplicate what we already have in place. We don't want to create additional administrative burden. We want to do additive. And so those are the conversations. Now, it looks different with every province because the provinces have healthcare jurisdiction. And so we want to make sure that we get our fair share and that it is able to, as I say, enhance what we currently have. We've been working with the Diabetes Working Group, and they have made some very strong recommendations on the types of devices that need to be sponsored and looked after, et cetera, as well as the insulin types. And I know that on the current formulary, these devices and insulin types aren't there, but I know that Minister Holland and his team is committed to working with us to make sure that it's the most up-to-date devices, the most up-to-date insulin products that we have available. So there's a lot of work that has to be done, but we don't want to duplicate services. We don't want to set up another admin process, but we do want Alberta's fair share to come to Alberta so that we can administer it. As I said earlier, given the fact that we do have jurisdiction in this area.
Yeah, so I should be clear that we're not looking to manage this. This is the provinces that will manage the administration of their pharmacare programs, and that every province is different in terms of what it might need in its formulary. When we announced the memorandum of understanding with British Columbia, as an example, they were able to take some of the money that they were saving through this program and partnership to help us announce something that was unexpected, which was menopause replacement therapy for women. So we were able to add that as an additional ambition within the farm agreement. So you're going to see these are going to live a little bit differently in each province. But in terms of your question of timing, I think you start with what you have full alignment, and we're full alignment around the need. We're full alignment in terms of the administration of who's administering it. We're in full alignment of making sure that Alberta gets its fair share of those dollars. So I think those are really good starting points and a really good basis for getting an agreement done quickly. And that's certainly what we're going to work as hard as we possibly can to see get done.
Hi, Aaron Sousa with the Canadian Press. Thanks for taking our questions. Sort of sticking with that similar topic, I mean, Minister LaGrange, discussions have been happening for a while now related to a pharmacare deal. Experts are saying that Alberta needs to strike it, before people fall through the cracks. It's a now or never situation. The official opposition even slammed it in question period yesterday. So just sort of reiterating why is it taking so long for Albertans to see a deal?
Well, again, we have to work through all the intricacies that are happening behind the scenes. As Minister Holland said, and it really only went through the House or through the Senate there in October when it was approved. So I believe there's been no dollars flowing to any province yet. So we're not losing any dollars. We just need to make sure that the deal that we get is the right deal for Albertans.
And my follow-ups for Minister Holland. So I'm wondering too if you can also clarify. It's sort of a follow-up to Shailen's question, specifically about the pitch. It's clear that with the province already stating that they want to opt out of this federal pharmacare deal before anything is really set in stone. This was back earlier in the spring. What exactly are the sticking points? Clearly, they're not happy. So what is the elevator pitch that the feds are working off of?
Well, this is a bit different because I think there's some confusion around the discussions we're having around dental, because dental is administered federally, and Adriana and I have had great conversations about that. I've said I don't have any problem with Alberta administering it. We both agree that if Alberta were to take it over, we would have to have conversations to make sure continuity of care and level of care. So, but on pharmacare, it's not about opting out in the sense of like jurisdictional concerns. This is administered by the provinces. They have the full stop. There is no federal administration of these programs. What we are doing with provinces, and I think it's a really great example of how we can work together, right? Because we're saying, look, this is provincial infrastructure. It's going to be managed by the provinces. We're coming to the table with money to help actualize making sure people get the diabetes medication they need and the contraceptives that they need. And now we're just talking about the formulary and about how it's actually going to functionally work. And I can say, not just here in Alberta, we're very, very close in a number of jurisdictions. You're going to be seeing us announce a whole bunch of agreements. So we're very, very close. But these things aren't easy, right? You know, and I remember the working together and aging with dignity agreements, people were, when are you going to get them done? Is this happening? And so it takes some time, right? And including with the what we're announcing today, drugs for rare diseases, it takes time. But, we're doing it in a spirit of collaboration and partnership. And I just want to speak about why that's different and why it matters. Because I think when we work by trying to find out where it's common and where we can work in that spirit of shared objectives, it's much more enduring, right? It's much less combative and it's much more positive. So I think that we ended up with really great agreements in the working together and aging with dignity side, because we took the time to really get to a point of collaboration. And I think that's really important here in pharmacare. Now, we don't have a ton of time. We got to get the need is huge. And I can speak to that for a second. Diabetes costs us $30 billion a year. It's a crushing number and it's growing every year. And it is so heartbreaking to talk to doctors who have patients in front of them and they can't follow the advice. And they watch these patients come back they're blind, they're limb amputated, they have a worse chronic disease and illness, God forbid they die. So it's critical we get medication to people. And I don't think there's any disagreement on that. I think it's more about just as quickly as possible working through those logistics. We had a very positive conversation on this very subject before we did the announcement here today. So our officials and Adriana and I are in constant contact. We're going to work through these issues as quickly as we can.
Thank you.
Hello, Graham Thompson, freelancing for the Toronto Star. Good to see Ottawa working with Alberta, and I'm glad you two are here today, because speaking of working together, 2 years ago, the federal government, Health Canada, helped Alberta import children's pain medication from Turkey. I think you're aware of this so-called Turkish Tylenol. $70 million contract, $28 million was delivered. $42 million is still outstanding. It's been 2 years. I talked to the Premier yesterday who said that Alberta is now working with Health Canada to get more product brought into Alberta. Can you explain how long have you been working together on that? What products are we talking about and how soon will these products arrive?
Sure. So Alberta Health Services identified products that they could use here in Alberta. They're adult products. I'm not going to get into the names of them. I don't have them right in front of me, but that would benefit all Albertans here in the province. They have been in obviously in negotiations with the company, with Atabay, and also to get them here, similar to what happened with the children's medication, we had to go through Health Canada for approvals. And so where that is at right now is getting the approvals. Now, it took quite a while the last time. So, again, having had the opportunity to have a conversation with Minister Holland today, just to say, we know it's going through those approvals. There's reasons those approvals have to be done, have to be gone through. There's processes. And as soon as we can share something, we'll absolutely share it. Hoping soon.
Yeah, very soon. I mean, look, this is done at an arm's length, the approvals, which is appropriate. Health Canada is recognized across the world as being one of the premier regulatory bodies in the world. And so we need to protect that. I think one of the things we're working with Health Canada is to interrogate all of our processes, all things that are legacy. Do they make sense? Can we make them faster? While still maintaining that very high level of regulatory rigor. But I can say that we're in our offices anytime there's an issue. We're immediately in contact and we're working together. So we'll work through those approvals as quickly as possible.
It's not really an answer. I'm trying to find out what actually is happening. You're telling me there's talks going on. How long have you been in talks? And the thing is about the actual products we're talking about, the Premier said she wouldn't tell me the names of these products, even though 2 years ago, you were very upfront, the kind of drugs that you wanted from Atabay, now you won't tell us. So do you have a list of products? You said the name's not in front of you, but can you give us a list?
Graham, I can tell you that, that when I came into office in June of last year, I asked about the credit that was owing on to Albertans, because I want to make sure that we get good value for those dollars that are sitting over with this company who stepped up and was able to supply a contract when we were in desperate need for children's medication at a time when people in Alberta and around the world were panicking to get this information or this medication for their children. So my goal has always been to get products that we can use, get maximum value out of that, what's remaining on the books there. And that's what's happening. So Alberta Health Services is negotiating with the company, but I also know that there's processes they have to go through with Health Canada. So once those processes have been gone through, I will be happy to share exactly what those medications are.
Hi there, Jonathan Bradley, Western Standard. So you spoke about the Canadian and Alberta government signing the agreement for $162 million for rare diseases. What was the process like to reach this agreement?
Well, again, we've been working on it for the better part of almost a year, I would say, behind the scenes with our officials. It's been a good process. There's back and forth. And of course, we want to make sure that we're also aligning with other provinces with what the medications are that they're approving, the drugs that they're approving. So my understanding, it's been a very good process. It just takes time. Now, no one ever misses out on any of the dollars flowing because these contracts, regardless of when you sign them, they're retroactive to when those dollars were initially promised.
Okay, and
Anything you wanted to?
Minister.
Yeah, look, I think one of the great things about the relationship that Adriana and I have is that we can, just text each other or pick up the phone, or I can say, I'm coming to Alberta. Can we make time? And so we sit down and we talk a lot, not just about these specific agreements, but about health transformation generally. And we share really our goal and our aspirations and our hope for our health system are very similar. So I would characterize our working relationship as excellent. And it's one of the reasons why this is the third deal that we've done here together, but also on drugs for rare diseases, why Alberta is the number 3 one in the country. We signed in BC, we signed in Newfoundland and Labrador. This is the third deal that we've done. And it's because I think we're able to navigate, this is complicated. There's a lot of different questions around, how we should approach these things. But because we have an understanding of one another and a really solid working relationship, we're able to get these deals done and really improve health outcomes for Albertans and Canadians together.
Okay, and you spoke about when some of these people catch rare diseases, how they might have to sell their home, they might have to be put into a precarious financial situation. How do you anticipate this agreement will enhance people's quality of life?
Yeah, it's a big deal. Like if you're a patient with one of these rare conditions, having the support to get the medication you need is game changing. And I think of in different situations where our health system, because I think we have to acknowledge that there's things that don't work about our health system, but there's other things that are phenomenal. Like I was talking to Katie and Andrew, or one of their kids was sick with a rare illness, and the ability of them to go to get their care for free. They were staying at Ronald McDonald House so that they could stay close to their child when they got world-class care, and that it didn't cost them anything. And one of them was a nurse and one of them was an engineer. Like they're not people with huge amounts of money. It would have crushed them. And the husband was telling me His sister lives in the United States, went through a similar situation. It just devastated their family's finances. And I think it's really important for us to cast our mind into the life of a family that gets a diagnosis and imagine what it's like if not only do you have the diagnosis and worry about somebody you love and care about is going to live, but you're wondering, like, how are we going to pay for this, right? Like, you got to go and ask family members for money. Maybe you got to sell your house. Like, you've got to forego your retirement plans. Like, it's devastating. And to add that, layer that on top of a diagnosis, we don't want that. And that's what today's announcement's about, is about getting people the support they need.
Thank you.
Hi there, that's Cabby Malley there with Global. Thanks for taking my question. I just wanted to get a sense of, just based on the investment announcement that you just brought up today, are you able to quantify in terms of how many Albertans that this will actually help? We've done countless stories in the past of just folks who say they aren't able to access healthcare, especially with these rare diseases. So I'm just hoping to get a number on that.
Do you know what? I'm not sure if I have an absolute number on it, because as I said earlier, it can range anywhere from $250,000 to $1 million per person. Right now, I can tell you last year we spent $130 million. This will add an additional $54 million annually to the budget. And so I don't have that at the tip of my fingers, but if you can check it with my department, with my office, they'll get you that information.
Okay. No,
I would say thousands,
thousands.
I would say hundreds to thousands for sure.
Okay. Thank you.
Okay, we will now proceed to questions from journalists online with Zoom. Nous allons maintenant prendre des questions des journalistes sur le Zoom.
Thank you, Matt. So as Matt noted, we're going to start questions on Zoom. So if you're a reporter and wish to ask a question, please use the raise your hand function. And we ask that you limit yourself to one question and one follow-up. And unless I've already stated it, if you could just indicate your name and media outlet before asking your question. Nous allons maintenant prendre les questions des journalistes sur Zoom. Si vous êtes journaliste, vous désirez poser une question, veuillez utiliser l'option de lever la main. And we'll see if we have any journalists that would like to ask a question at this point. And last call for journalists on Zoom. Dernier appel.
That's it.
Okay.
Nope, and there's no questions on Zoom, so back to the room. Thank you so much. Merci.
Thanks, everyone.
Thanks, Robert.